You arrived at the scene of a 25-year-old male who was in a bar fight and was shot.
BSI, is my scene safe?
Scene is safe.
My number of patients is 1. My mechanism of injury is gunshot wound and possible assault. I'll have ALS on standby. I'll have my partner take and maintain C-spine stabilization throughout the duration of this call. What do I see, smell, and hear?
You see a 25-year-old male lying on the ground who appears unresponsive.
Noted. My general impression on my patient's 4. Hey sir, I'm Sergeant Hatch from METC EMS. Can you hear me?
No response.
Hey sir, if you can hear the sound of my voice, go ahead and squeeze my fingers or blink your eyes.
No response.
I'm going to squeeze the trapezius looking for facial grimace. Do I have anything?
No response.
I'll go ahead and check for cardiac pulse.
Patient has a weak pulse.
Noted. My patient has a weak pulse and is unresponsive. I will go ahead and scan the body looking for any life threats. Do I see anything?
You see bright red blood coming from the right upper arm.
Noted. I will go ahead and take direct pressure with a pressure bandage. Is my wound managed?
Wound continues to bleed.
Noted. I will apply a tourniquet high and tight to the wound. Is my wound managed?
Wound managed.
Noted. Do I have any other injuries at this time?
Not at this time.
Noted. I will open my patient's airway using the jaw thrust maneuver.
You see blood and vomit in the airway.
Noted. I will turn my suction on, kink my tubing machine 300 milliliters of mercury, insert, release the kink, and suction in circular motion for no more than 15 seconds on the way out. Is my airway clear?
Airway clear.
Noted. I will measure and insert an OPA. Does my patient tolerate?
Patient tolerates.
Noted. I will go ahead and get a breathing rate quality on my patient as well as an SpO2. What is it?
SpO2 is 88%. Breathing is 6 and shallow.
Noted. Okay, setting my tank to 15 liters per minute. I'll give 1 breath.
Oxygen is on and flowing. Ventilation complete.
Noted. I will have my partner continue to give 1 breath every 6 seconds. Moving down to circulation. I will quickly scan the body looking for any life-threatening bleeds. I will also check my patient's pulse, rate, and quality, as well as get a skin color, condition, and temperature.
You do not find any further injuries. Pulse is weak and thready. Skin is pale, cool, and clammy.
Noted. I will now begin my systematic head-to-toe rapid assessment. I'm going to be palpating all anatomical parts of the body, looking for any decap, BTLS, that's deformities, contusions, abrasions, punctures, penetrations, burns, tenderness, lacerations, swelling, crepitus, and any life threats for 60 no longer than 90 seconds. Do I have anything?
No injuries.
Noted. Does my patient have a pelvic injury?
No pelvic injuries.
Noted. I will go ahead and measure and apply a C color to my patient. You said no pelvic injuries, correct? All right, on my partner at the heads count, we will go ahead and log roll the patient. I'm going to check the posterior lumbar, back, buttocks, and thorax for any decap, BTLS, any crepitus, any life threats, any blood, any incontinence or drainage. Do I see anything?
You see a gunshot wound to the back with no exit wound.
Noted. I'll go ahead and apply an occlusive dressing. Is that wound managed?
Wound managed.
Noted. I will go ahead and log roll my patient onto the LSB on my partner's count. I will perform a V-slide for my patient. My patient is going to be a high priority for transport. We're going to go ahead and treat them for shock and transport them immediately. At this time, I'll go ahead and attempt to get a sample history from my patient.
The girlfriend is freaking out, telling you that he got into a massive fight with a really big dude who ran away.
Noted, and then I will attempt to get a baseline set of vital signs. I'm looking for blood pressure, pulse, respirations, eyes for pearls, pupils equal round reaction to light, skin, color, condition, temperature, SpO2, as well as a blood glucose level.
Blood glucose level is normal. Blood pressure is 90/68. Pulse is 112 and thready. Respirations are controlled with the BVM. Eyes are unequal. Skin is pale, cool, and clammy, and SpO2 is 92%.
Noted, I will now begin my systematic head to toe assessment. Starting up with the scalp, I will inspect for any decap, BTLS. Do I have anything?
No injuries.
Noted, looking at the face now, I'm going to look for any decap, BTLS, and crepitus. Do I have anything?
A laceration to the cheek with minimal bleeding.
Noted, I will go ahead and inspect the ears, looking for any decap, BTLS, any crepitus, any CSF, blood drainage. I'm also going to look behind the ears over the mastoid process for any vital signs. Do I see anything?
You see battle signs and CSF drainage.
Noted, I will go ahead and inspect the eyes, looking for pearl, that's pupils equal round reaction to light, any dust, debris, contact lenses, or redness. Do I see anything?
Pupils are unequal.
Noted, I will go ahead and look in the nose, inspecting for any decap, BTLS, any crepitus, any blood drainage, or CSF.
No injuries.
Noted, I will look in the mouth, looking for the acronym blood, that's broken or loose teeth, lacerated tongue, unusual odors, obstructions, or discoloration. Do I have anything?
No injuries.
Noted, I will move down to the neck, looking for tracheal deviation, jugular vein distension, also at the back of the neck for C1 through C7 step off. Do I have anything?
Tracheal deviation.
Noted, I will move down to the chest, inspecting for any decap, BTLS, any crepitus, any paradoxical motion. I will also take lung sounds, mid-clavicularly, mid-axillary, bilaterally.
No injuries. Lung sounds clear on the right, absent on the left.
Noted, I will contact ALS to intervene with a needle D for a suspected tension pneumothorax. I will move down to the abdomen, assessing for any tenderness, evisceration, rigidity, distension, surgical scars, swelling, or pulsating masses in all four quadrants. Do I have anything?
No injuries.
Just to clarify, I did not have a pelvic injury, correct?
No pelvic injury.
Noted, I will press in and down on the iliac crest, looking for any shift in the pelvic wing, any decap, BTLS, or crepitus. Do I have anything?
No injuries.
Noted, I will look at the genitalia for any soft tissue injuries and priapism in males.
No injuries.
Noted, I will move down to the lower extremities, looking for any decap, BTLS, any crepitus, as well as CSMs, that's circulation, sensory, motor, checking bilateral pedal pulses. Hey sir, can you feel this? Can you wiggle?
Abrasions to both knees. No response to sensory motor. Pulse is present.
Noted, I will move to the upper extremities, looking for any decap, BTLS, and crepitus, as well as CSMs, checking bilateral radial pulses. Hey sir, can you feel this? Can you wiggle?
No injuries.
Noted, I will go ahead and perform a blood sweep on my patient, looking at the posterior lumbar, back, buttocks, and thorax, looking for any blood, any incontinence, any drainage. Do I see anything?
No injuries.
Noted, I will now manage all my secondary injuries.
Minimal bleeding to the face.
Dry sterile dressing.
CSF from both ears.
Loose dry sterile dressing to collect the drainage.
Abrasions to the knees.
Dry sterile dressing.
All wounds managed.
All wounds are managed. Noted, I will go ahead and we were already transporting my patient. We're going to reassess vitals, interventions, primary, secondary assessment, as well as chief complaint every 5 minutes en route, and I am done.